Hello, Big Sky. I'm Eric Ladd with Outlaw Partners, and today I am joined by co-host Joe O'Connor, who is our Vice President of Media and Editor-in-Chief with Outlaw Partners. This virtual town hall platform was developed a few years ago to address important community topics with leaders in our community. Today's virtual town hall is being brought to you in light of the recent round of virus spread and illness in our community, coupled with the record numbers of visitors here enjoying Big Sky. Being a small town resort, we see an influx of people from around the country and the world who are here to enjoy the resort and the amenities. And it appears that with this influx in visitation this year came all sorts of illnesses. In my 22 years of living in Big Sky, I've never witnessed such a dramatic swing of people getting sick, empty shelves of medicine, and people getting testy with pharmacy workers because they can't buy 2 thermometers at once. True story. I witnessed it today. It's starting to feel like frontline workers at the resort and medical professionals should be getting hazard pay. Needless to say, our town is overwhelmed and is feeling a bit of tension right now amongst all the coughs, colds, fevers, sniffles, and businesses that are having trouble keeping their doors open and staff there. So let's dissect it. We've assembled an amazing panel today who are decision makers and experts in the community. Today, we're joined by Troy Nedfed from Big Sky Resort, Taylor Rose from the Big Sky Medical Center, Danny Burschwal from Big Sky Resort and Big Sky Relief. Big Sky Resort Tax and Big Sky Relief, Dr. Kaylee Burns from Big Sky Natural Health, and Dr. Jason Moore, a PhD and epidemiologist and an emergency room PA. How this is going to work tonight is we're going to spend about 10 to 15 minutes talking to each speaker. You're welcome to submit questions in the comments section of the Zoom or the Facebook, and we'll do our best to address questions. And we're going to roll through talking to Big Sky Resort, the medical center, and the resort to kind of do a holistic look at the community. And then we're going to finish with 2 doctors to really dive in and talk about more the medical side of what we feel is going on here and try to give you all some some steps to move forward with your lives and understand what's happening. So let's dive into it. I'd like to welcome Troy to the platform, Big Sky Resort. How are we doing, Troy?
I'm doing good, all things considered. Skiing is pretty fantastic today.
Nice. Well, I got to ask you, what's been your highlight so far with opening the resort?
You know, it's great that we do have snow now, and I'll be honest with you. I mean, we'll get to the challenges that we're all experiencing right now, but there's some pretty fantastic stuff going on around as well. New lifts, people skiing. Boy, I'm blown away by how well some things are going, all things considered.
Yeah. Well, congrats on getting that new Swifty open, by the way. I know everybody's loving that. That was a game changer for the resort. Mm-hmm. So let's dive into it and kind of talk about, you're the big dog in town. You got obviously people come to Big Sky to enjoy your amazing resort, and a lot of people are coming in. Let's start, top down. How is any of the recent stuff with COVID or any of the other illnesses affecting operations? Anything that people should be expecting coming in, and anything you've had to modify to keep the doors open?
Yeah, it's pretty fluid, as you all know. It's a dynamic situation. We're in a different place than we were last year. We were hoping it was going to be, I don't know if I'd say easier, but different. There are some things that are different, that vaccinations are in play. But as we all know, the new variant has thrown a wrench in so much of it. And it's real. It's challenging to, we started with shy of a full staffing plan because our community is fully staffed. So we all know that challenge. And then on top of it with COVID right now, it's certainly throwing some curveballs. And we have some folks that are working really hard to keep this resort running right now.
So any changes in terms of guests, they showing up, or how are we at with masks right now, or are we using those indoors? I mean, what types of things are you asking for guests to do?
Yeah, we shifted gears. We were hoping to not have mask policies and let people make some choices for themselves in that area, but it became evident that it was necessary for us to require them indoors, just with the density zones and people, as you already suggested, people flying in from all over the place. It seemed evident that we needed to make that move. It's that in advance and share that with guests, but we also have to do the safe thing. And I think we did that on the 24th, made that move, and we're real comfortable with that, and it seemed absolutely necessary. Currently, guests are coming in, and many people are, all of our employees are wearing masks indoors. Guests, we have a mixture of compliance. I'd like to see more of it. And hopefully we'll gain more of that moving forward.
Excellent. And how's your staff holding up? I mean, I'm hearing that you're having some rough days with quite a few people going down with various illnesses and such. I mean, how's that looking for you?
Yeah, they not exempt from that challenge like everyone else in our community. We had a lot of folks every single day. There's new folks that are calling in. We have a pretty robust testing program right now that we're trying to catch stuff in advance and get people that aren't feeling well to stay home. But it's much faster. It's coming at us much faster than it was last year. And we got a lot of folks in some key positions that are not in play each day. To be as transparent as possible, we have lifts that are not open. Some of our real estate lifts that we normally be operating at this point, we just don't have the staff to do it. So we're having to make priorities every single day to make sure that we're going to stay open.
Yeah, well, you gotta do what you gotta do to stay alive there. So that's, and I'm definitely hearing that, especially on your frontline employees. I'm hearing that across in the other resorts in town, as well as yours, that F&B and a lot of frontline employees are kind of taking some of the harder hits.
They are. The F&B program last year, I think, was the hardest hit, and I was expecting it to be even harder. But I'll be honest, our F&B teams are killing it. And believe how many adjustments they're making on a regular basis to keep our guests fed, and making adjustments throughout. So F&B is, it's the challenge we're experiencing everywhere, but it's going pretty well, all things considered.
How are skier numbers so far this season?
We're the visitation is higher than it was last year. Obviously, we had some pretty strict restrictions and caps in place last year. We're still not opening the floodgates. We have, things in place that we're certainly prioritizing guest experience over volume. These are not record Christmas days for us. And to be completely honest, I'm happy with that. I think we've got our hands full with what we've got right now.
Yeah. Kind of an aside, try to be curious on just your reaction. What would be your thoughts of resorts having limitations moving forward? I mean, it seems like on a lot of fronts, it might be kind of nice for resorts to have caps for a lot of different reasons.
There's a lot of ways to go about it, and there's a lot of different business models in the industry. And I think there's some aspects of what you just described that we embrace, and maybe doing that some in the future. I'm not saying caps, but we got certainly a different mentality than some of the other ski companies in the industry. We want to preserve the experience. The elbow room right now, if you look at Vail Resorts, Aspens, and some of the folks out there, high density skiing out there. And I don't think that's what we're looking to, that's not our goal.
Yeah, well, we appreciate that. People that are watching this that either live local and coming up to the resort, or they're thinking of traveling into town, any advice for them as they plan their trip or their vacation to come up and visit you?
Yeah, it's plan ahead, buy your lift tickets online. Obviously, buy early is the best way to do it. A lot of things that we're selling out of. We experienced this all last winter, high demand in our community for skiing, for the experiences that we have out there. And you just got to plan ahead and expect and be respectful of those at the resort in our community that maybe have different ways of going about things. But some people, they need some space. So let's give everyone plenty of respect and space.
Excellent. Well, we appreciate that. And you touched on this a little bit at the beginning, but you said snow conditions are getting good. Did you get some skis on today?
I did. We started off with a pretty thin year and some really warm temps, unseasonably so. But it always comes around. And this is a La Nina year, which tends to hit us well. When California gets hit, we usually get hit pretty hard too, or soon thereafter. Right now, we're 94% of average, which everyone knows here, our average skiing around here is pretty darn good. So we're in a good place, and more in the forecast.
No, that's great. We sure need it. Well, I'm grateful for everything the resort's doing and appreciate the update from your end and everything your hardworking staff's doing. Joe, anything from your end?
Yeah, you talked, thanks, Eric, first of all. But, Troy, you talked a little about, just mentioned 94%, of average snow, and, your employees work super hard. I was curious, ski patrol, they work some serious long hours in some fairly harsh conditions. And with snow at about 94% of average now, how are those guys doing? And what's the word from them?
Whew. Listening to the radio today, that team is unbelievable. The level of professionalism, the can-do attitude, what it takes to open terrain with limited snow up to this point and getting creative with all of that is unbelievable. So how they're doing, at times they're operating, whether it's illness or other stuff that we have in play, they can be down 20% of their staff on a daily basis, and they're still making it happen. And you're exactly right. They're doing double time in a lot of ways. These guys are amazing. And listening to the radio all day, we're lucky to have them.
Yeah, definitely. Well, we really appreciate, their work and all of your work and all your employees. So thanks so much. And yeah, we're looking forward to a great winter. Back to you, Eric. Yeah.
Excellent. Thank you, Troy. Jumping down to one of the other big anchors in town, we've got Taylor Rose from the Big Sky Medical Center. April 6th, 2 years ago, was the first time we did one of these town halls, and Taylor let us off. That was right when things were starting to unravel the first time. So Taylor, we meet again. Welcome back.
Thanks, Eric. It's good to be here.
Excellent. Let's just start out with, first off, I am so grateful to have the medical center here on days like today, to be able to just drive down the road and have a pharmacy and great staff there and get testing or get an x-ray. It's just an amazing asset. But how's the facility and the team doing there, and what are you seeing?
Yeah, great question. Busy is kind of the word that I've got for it. We're seeing higher volumes, record-setting volumes coming through the medical center. It's to be expected. A new hospital, year over year, you see increases, but this past year has just been explosive for us when you look at volumes and everything that we're doing. But then over the past 2 weeks, even the testing has just gone to the next level. What we normally see on a busy day, we're probably 300% above that as far as the tests that we're running at the medical center for the swabbing and stuff like that. So just very busy. A lot of appointments, a lot of ER visits, a lot of imaging visits, pharmacies filling more prescriptions than ever. Just busy.
Right. And what type of trends are you seeing with illnesses that are coming through the door, or people that are calling in? Is there something that's kind of dominating your landscape right now?
Yeah, we're seeing a lot of those people that just don't feel good, or feeling cruddy, that are coming in. The traumas and stuff that come in off the mountain. Thank you, Troy, for that. But just all that stuff that comes in. That's pretty much the same. Nothing new there. Volumes are going up in that, but not significantly. It's primarily related to COVID. But then also we're seeing just a lot of demand from just more people being here and staying longer. So primary care, the clinic, seeing more appointments and more visits, our imaging services, people not wanting to travel down to Bozeman or whatnot to get their MRIs, CTs and stuff like that. They're trying to stay up here, which is why we're here.
So on the testing front, and I came in today, did one of the PCR tests to do some international travel. So I went through the program, it worked well, made an appointment ahead of time. It was a drive-up process, worked well. Why don't you walk viewers through a little bit on how, what testing capabilities you have at the hospital and what they should be used for. Obviously, there's limitations on, I think your nurse told me today that it was 100 tests today that they had available for that. And they thought they would go through that no problem. So, when should people be coming and for what reasons, and how should they be doing that?
Yeah, so that's a big question to kind of dissect that a little bit. The hospital is focusing on PCR testing. We have a couple of different ways that we can run that testing. One that we've had for a while is there are rapid tests that take about 45 minutes to do a rapid PCR test. Those were we set aside more for emergency room patients, people that need it, these quick results. And then through some philanthropic support and the Big Sky Resort tax, this last, it was about 3 months ago, they approved to give the hospital some funds, and we were able to purchase a Panther machine for the hospital. Now, this Panther machine is a PCR test, so it runs the same kind of test, a really highly accurate test, but it runs it in high volumes. And so what that's been able to do is it's allowed us to, like you said, provide travel testing for people in the community while still being able to run our normal symptomatic testing that we have. That machine can test hundreds of patients a day. The bottleneck that we're seeing right now is really just our staff's ability to register, process, collect those specimens, and get people like the actual specimen in hand. We've been used as a backup for tests coming from Bozeman, and we've done hundreds of those a day at times. So we don't have a limit on the availability of tests at this point. It's really just a staffing issue. So
gotcha, that makes sense. Asymptomatic people who are just concerned, what advice are you giving them? You want them coming in, if they feel like they've been exposed, or should they stay home and ride it out? I mean, what's the advice you're giving people?
I think if people are asymptomatic and they don't have an exposure, testing is not necessarily required. If you've been exposed and you feel like you should get tested, then by all means, come on and get tested. We still want to provide that service for the community, of course. So,
okay. Any 30,000 foot up data that you're seeing in terms of COVID trends, flu? I mean, you're hearing now that now flu's miraculously back a year later. It would seem to disappear last year, but
yep.
I have quite a few of my staff that are sick out with flu right now. So, what types of trends are you guys seeing?
Yeah, so that's a good question. I looked through some of our data last week. We had about a 23.5% positivity rate for all the COVID tests that were done. And then we had about a 12.7% positivity rate for flu tests that were done. And so we had about 118 of those people come in that got these panel type tests that test for COVID, flu, and RSV. And like I said, about 12.7% of those were positive for flu. So overall, we're seeing pretty high disease burden in the community right now. And as you mentioned, last year, the flu was almost non-existent. And I would say that that's attributed to people masking up more frequently, better hand hygiene, social distancing, those things that, worked. They're just more lax now. And so we're seeing the positivity rate of all disease transmission go up.
Okay. Well, and that's probably, I've never seen grocery store shelves empty of things like I saw today. You can't buy cold and flu medicine or vitamins or cough drops. Everywhere is cleared out. So, I think that obviously there's probably, as you stated, there's an increase in that. And I also feel like there's a little bit of the toilet paper syndrome going on right now, where we have people bum rushing and stockpiling stuff.
Mm-hmm.
And then I know your pharmacy said they were experiencing a little bit of that today as well.
Yep.
From a medical perspective, can you touch on just, the difference, endemic and a pandemic, and kind of where we're headed with, this will be something we'll touch with Jason too, but COVID seems to be something that's kind of maybe, starting to change a little bit in terms of how it's being considered as either a pandemic or an endemic, and we're going to live with this the rest of our lives. Any thoughts at the medical center you'd want to share on that?
Jason's probably a better person for that. My understanding of a pandemic versus endemic is an endemic, we have more of a predictable transmission rate for the disease. If you ask me, I think COVID's here to stay. And so I don't know what the official classifications are for an endemic, but I would probably, say it's here to stay, and we're going to start living with COVID. So.
Well, I appreciate that. And Jason, we'll be bringing that one to you in a minute here. Some just final questions, Taylor. From a community perspective, any support that the medical center needs? I know that the town has been a good rallying cry for helping out with, like you said, that piece of equipment and other things. Is the medical center in need of any sort of community support at this time?
When I think about the community, the thing that I would ask is just be patient and be kind to the medical staff. As I mentioned earlier, our volume is through the roof. We have many open positions at the hospital that we're unable to staff. It's very hard to recruit and staff a hospital in a resort town. Doing the best we can. Every single person at the medical center is working very, very hard. Most of them work overtime hours and just trying to serve the community and just do the best they can. So when you call and you don't get the answer that you want, or something happens and it's an inconvenience for you, just be patient and be kind and understanding to the people who are trying to serve the community here.
Yeah, well, that's great advice. So once again, appreciate everything you guys are doing. Your team did a great job. When I was there today, it was nothing but A service, and shout out to the pharmacist who had to argue the thermometer with that crazy lady. Joe, anything from your end?
Yeah, thanks, Eric. And yeah, Taylor, you guys are doing such a fantastic job down there. I know that it's quite a burden that's being placed on you and your staff. So just wanted to say that. Nice work. I was going to ask, in terms of that, of that pressure that your staff is feeling, could some of that be eliminated by folks getting a flu shot? You guys both mentioned, last year flu was virtually comparatively non-existent, and this year you said you're seeing 12.7% flu positivity. If people can get that flu shot and eliminate that component from something that could be infecting them, would you then, what do you think about the flu shot, and should people be getting that?
Obviously, we are highly pro flu shots, pro COVID vaccine. We provide those every week at the medical center. People can, sign up and get their COVID vaccines. I will say right now, there's been a run on COVID vaccines, and we're scheduling out a couple of weeks. So I would highly encourage people who would like to get a COVID vaccine to call and schedule now, or find somewhere down in Bozeman if you'd like to get it sooner. We're highly encouraging and trying to provide those vaccine opportunities for as many people as possible and as many locations as possible, to kind of remove that hurdle. Sometimes it's like, well, I just never got around to getting to the medical center. So we've done some clinics up at the resort with Troy, some of the other high volume employers up here, just to try and get as many people vaccinated as we can to reduce that disease burden, because we know they are effective.
Mm-hmm. We've got one question from the audience just to follow up. If you've had COVID, how long should you wait, if at all, to get vaccine?
That is a clinic question. I know there is a time frame to wait, but as I am not a medical provider, I can't answer that specifically. So definitely call your primary care provider if you have COVID and ask them what they would suggest.
Got it. Well, thank you, Taylor. We really appreciate you being here.
Yep, no problem. Thank you, everybody.
Okay, let's jump over to Daniel Birschweel with Big Sky Resort Area District. Danny been on a couple of times on this show. He's the executive director for BizRad. And Danny, welcome to the show again.
Thanks, Joe. Thanks for having us. Always a pleasure.
Sure thing. So, we've been talking about this, a lot of people sick, grocery stores full of, of people. This is the time when there's a lot of visitors here. What are you seeing in Big Sky?
Well, I think we not only are experiencing a very busy winter season, particularly when you look back at the tax collections, we're at like a 47% increase year over year from last year through November. It's interesting when you take a look at the impacts that are being had throughout our community related to service levels and absences with work related to quarantine and isolation. I think you're seeing a lot more businesses that are operating within abnormal hours. A lot of service levels that have traditionally been, 100% there 24/7. They're just not able to be able to operate during that time frame. So I think one thing that we're seeing is that funnel of the businesses that are open are experiencing even higher demand because of the ones that are closed, and the ones that are open are seeing high levels of visitation traffic, higher than even would normally have been there. So.
Yeah. Well, you mentioned, to me earlier that, tax collection numbers through, I believe you said October, are up 47%. Is that right?
That's right.
And are you, with that, there's obviously a tax on, the employers and their employees. Are you seeing businesses come to you? Are you getting requests for any sort of assistance from local businesses?
Yeah, I mean, as it relates to the testing initiative that we help to support through funding, we are receiving a lot of outcry from our small business community. And if there's a need that exists out there, please contact me directly at the resort tax office. The inventory that we have over at the chamber offices are committed directly to the community at large. So if you're a business and you need anything related to testing supplies, please contact me directly and we'll see what we're able to do.
Got it. Well, it leads me to my next question. You're just talking about the chamber and the supplies there. So there are rapid tests available at the chamber. How many are available and who are they available to?
Yeah, so last year we invested approximately $1 million as a community into the PCR testing program, which allowed for, pretty quick and immediate PCR results. This year we invested approximately $150,000 in testing for these rapid tests going into the winter season. We just weren't sure what our scenario would look like. And through our partnership with the medical center, secured that PCR machine over there. So what we're able to provide right now, and we actually recently doubled our distribution. Our supply was 10,000 for the entire winter, and we're starting to cut into our March and February supply right now by increasing our distribution, kind of crush this holiday rush and the Omicron variant impact on spread of COVID in our community. So it's 1,000 tests per week. Those come in a kit that includes 2 tests, Monday through Friday, 9 a.m. until they're out of stock over at the chamber facility. First come, first served basis. They're free of charge and funded through our local resort tax and public tax dollars, and they're only available for residents and employees that are not experiencing symptoms. If you have symptoms, we'll talk to Taylor over at the medical center.
Gotcha. Yeah, thanks for that. Well, we just talked about you guys reaching into your reserves for partly later in the winter. Is that a concern for you guys?
We are actively seeking to backfill the late winter supply that we have. And, that's why we're really, if you come in to see us over there at the chamber, it's 1 per person. And there's a reason for that, is because we have to make this last as long as we can, but we have doubled our distribution capacity.
So the PCR test is what's available at the hospital. That's sort of your gold standard. What do we know about the accuracy and efficacy of these rapid tests?
Yeah, one of the main things I would say with the rapid test, which Taylor touched on a little bit earlier, is if you test positive with the rapid test, you're positive. Isolate and quarantine per all the outlined procedures from our county health department and the CDC. So, the accuracy as far as the positivity rate goes, definitely extremely accurate. As far as the non-positive cases go, a little less accurate than the PCR tests, but we're comparing $1 million investment from a $150,000 investment in total for our community dollars that have been invested. So, is what it is with the antigen test to a certain degree. If you need to validate, you can always go over to the hospital.
Danny, talk a little about the micro impacts versus macro impacts of COVID, of Omicron.
Yeah. So, one of the things that we're really proud of is our partnership with all of the operational and funding and resource partners through Big Sky Relief. Those really have been working towards addressing what I would consider immediate micro level impacts that we have here as a community. So, for example, $800,000, primarily thanks to YCCF, went out to mental health grants this year. We know that behavioral health and counseling services and therapy services are direct impact at a micro level with COVID. We know that vaccine incentivization was a really important thing for us, Special thanks to Spanish Peaks Community Foundation and Moonlight for really taking the ball and running with that one. We were able to get a lot more people vaccinated through that incentive program. And then lastly, you know, the testing program this year really was only made possible because we got a procurement of these tests through Lone Mountain Land Company. So that Big Sky Relief Partnership has really been focused on these micro level impacts. When you take a step back and look at, you know, at a basic level, the land and the people that exist within Big Sky, there's a lot of kind of high level, macro level impacts that are happening. And you know, our Big Sky plan has really been working towards seeking implementation. And we've been working towards addressing health and safety, public works, recreation, conservation, economic development, arts, education, and housing. All of those areas had a impact from COVID-19. And we've been working with the implementation team to really get those honed in. What are the immediate needs and what are those, you know, more future facing needs that are long-term, and ensuring that we're kind of addressing the macro level impact of Big Sky on Big Sky from COVID-19 by working with all of the partners, the doers on the ground that are implementing that Our Big Sky plan, but also the local foundations and resource partners that are really here to help contribute into supporting the community towards making these problems a solution.
Yeah. Yeah, thanks for that. Those are important, very important components. So I just want to back up for a quick sec. Big Sky Resort Area District, you're the executive director. Talk a little about the relationship that you guys have with Big Sky Relief and your role within that.
Yeah, we're with the foundations, one of the founding partners of the group. We help to not only provide financial resources with Big Sky Relief, but also keep the band back together. You know, we go through periods of time where the operational and resource partners, you know, things are relatively at a micro level happening fairly smoothly here within the community as it relates to the impacts of COVID-19. We were all taking a step back and really looking at how we can address these things in a more strategic way in the long term. In the interim, though, what BizRad is helping to do is to pull the band back together when we need to and get everyone aligned and make sure that we're cohesive in our approach and our messaging.
Got it. So you guys are doing a great job together supporting, you know, the community. Where is their need and support, you know, from the community? What can we do? What do you guys need?
Yeah, you know, I think everyone has a certain level of personal and individual social responsibility as it relates to COVID-19, but not only that, how we operate as humans. You know, Eric touched on this with the tooth thermometer example, and I found a quote that I'm going to change from personal responsibility, but move it into more of a community level. And it's from Dr. King, and it is: the ultimate measure of a community is not where it stands in moments of comfort and convenience, but where it stands in times of challenge and controversy. And Troy touched on the fact that we need to prioritize and make sure that we're focused on the right things. And, you know, in this time, I think our community, our neighbors are looking for individual leadership from each of you throughout our community of Big Sky. And we need to prioritize things like hope, compassion, and shared responsibility for Big Sky's future. And the stories of people hoarding tests, the stories of tooth thermometers getting argued at the pharmacy, the stories of frontline workers getting hammered on a daily basis, there's no place for that in Big Sky. Big Sky is the community that we can choose to build through hope, through compassion, and really focusing on our future. And if I had one piece of advice, it's be kind.
Yeah, that goes a long way, doesn't it? Yeah. Well, Danny, really appreciate the work that BizRad's doing, that Big Sky Relief is working on for the community. Yeah, I think ending on Dr. Martin Luther King is a pretty powerful way to end it there. But I would toss it over to Eric. Eric, had follow-ups or questions from the audience?
Yeah, I'm going to bring it back to Troy here in a second. There was a question for him, but Danny, thank you for everything you're doing. You didn't know when you took the job, you're going to become the de facto mayor for our little unincorporated village. So that's a town hall for another day. But Troy, questions about New Year's Eve parties, how you guys are handling gatherings, music, après-ski, things like that. We've got some questions coming in from the audience on that.
Yeah, I guess I don't see the questions, but I can certainly address it. You know, with things moving so fast, we we made some moves to just get rid of the unnecessary stuff. Obviously, there's plenty of skiing to be had, and get out, spread out. Christmas Eve, we had canceled our traditional services that we have up here that we realized it just wasn't the right thing to be hosting them. Beyond that, New Year's Eve, we're going to be doing fireworks, but at a 9 o'clock thing, because we just don't need a show. We don't need a big scene up here. It doesn't need to be a big party, but just a little bit of for our guests up here in lodging to have something to watch. From an opera standpoint, a little bit of music that goes along with some of our dining experiences, but we've put everything back because we're trying just to stay away from any sort of large scale gatherings that just doesn't seem responsible and safe at this time.
Excellent. I appreciate that. And I know that's consistent. I know Spanish Peaks and Moonlight both canceled their New Year's Eve celebrations, and I believe YC did the same. So I believe everybody's trimmed that back. But that was it for questions on this end. Joe, over to you.
Yeah, thanks, Eric. Let's move over to Dr. Kaylee Burns. Dr. Burns received a doctorate in neuropathic medicine from National University of Health Sciences in Chicago. She owns the Big Sky Natural Health in Big Sky and has been in the area for a couple of years now. Dr. Burns, welcome to the show.
Thanks for having me.
Very welcome. So if you could, please just tell us a little about your practice and about naturopathic medicine a little more generally.
Yeah, so naturopathic medicine is a distinct primary care, and we focus mostly on preventative medicine. Our goal is always to reestablish and optimize health using more holistic means.
Mm-hmm. And yeah, your business has been, you started about 2019. Mm-hmm. How's everything been for you? What are you seeing in terms of patients and has there been an increase?
Yeah, it's been great. We've been busy. We've expanded. We have a couple acupuncturists now, as well as a nurse who's been super helpful, especially these last couple of weeks. We've been pretty slammed, and yeah, we're rocking it out. It's great.
Yeah, gotcha. Yeah, that's any medical system is feeling the hurt right now in terms of staffing and pressure. So with that, there's a bunch of different things, it appears, going around, bugs, whatever you want to call it, COVID as well. What do we have going around the community in Big Sky right now?
Yeah, so we've seen everything from flu, RSV, COVID, stomach bugs, you name it. We're not actively seeing COVID patients, but we get a lot of people post-COVID who are just continuing to struggle for weeks at a time. So a lot of people are just really needing kind of a holistic standpoint to help build their system back up and keep going. Mm-hmm.
So, for, our viewers out here, for all of us, how do you handle your efforts in treating, an illness if you don't know whether it's, call it flu or a cold or COVID or a GI issue?
Yeah, I mean, we can do pretty well in terms of our intake, what kind of symptoms they're having, the history behind it. I would say the vast majority of people have at least ruled out COVID, or know that they've had the flu or something of that fashion. But I would say probably the majority of what we're getting are people who are either kind of at the tail end or post-infectious dehydration. They're needing some nutrients, they're needing some guidance in terms of their nutrition or other lifestyle factors just to try and prevent this from being something that continues to happen.
Mm-hmm. So what do you have for basic health tips? I mean, we've all heard, washing your hands, staying hydrated. What are some ways to stay hydrated, for example?
Yeah, so one thing we really like are electrolytes. We use those element packets. I'm sure a lot of people have seen them around town. The nice thing about it is they don't have sugar in them, so you're actually getting hydrated without also pumping sugar into the system. Excuse me. We do a lot of IV therapy. So a lot of hydration bags, plus we can add a lot of vitamins to that. It's a drier time of year. A lot of people aren't as thirsty. It's colder. So that's just something we really encourage people to stay on top of. Drink right away when you get up in the morning. You get dehydrated overnight. Other than that, the really big things are your diet, your nutrition. We're in the thick of holidays, so a lot of people have kind of maybe lost track of their good, nutritious foods. So really bringing that, and you can get a lot of hydration through your food as well, especially this time of year with more soups and things like that.
Yes, there's some good soups out there for sure. What about, what do you know, obviously right now gathering with people, I mean, is there a concern? Is there a safety measure? Any recommendations in terms of, you know, gathering with family, gathering outside of family? Yeah, what do you see in there?
Yeah, unfortunately, I think this recent spur in pathogens has kind of reminded us that the pandemic is still very present here. And I think it's kind of made a lot of us aware of some of our personal and collective struggles in terms of not being able to gather like we would prefer to this time of year. At this point, just given how many people have been exposed or infected, I would say it's probably best for a lot of us not to do that right now. But it is a time that we could probably take a little look at our own personal health and try to figure out how to keep ourselves as strong as we can.
Mm-hmm. Definitely. That's great advice. And a lot of that hasn't changed in a long time, right? I mean, these are some very basic ways to keep ourselves healthy and, you know, virus free.
Yeah, definitely.
Yeah, well, thank you, Kaylee. Really appreciate it. How are you holding up? How's your staff doing? Talk a little about that. You guys,
We're all a little bit tired, but we're doing well. We can give ourselves fusions, so we're staying strong.
Oh, that's great. That's great. Well, thank you very much. You guys we really appreciate the work, and it's so helpful to just hear your advice and the ways that you and your staff are living their lives and advice for everyone else. Really appreciate it. Eric, any questions from you or do we have?
Yeah, I've got a couple that I'm going to bounce around here. Kaylee, advice on sleep. I mean, that's a big one. That's pretty important to people right now. And what's kind of your 2 cents on that?
Yeah, I think just kind of the sleep hygiene practices are really important. So dark room, temperature control, white noise works for some people. The sleepy time teas are pretty nice. My kind of go-to would be magnesium. Most of us are deficient in it, but it helps with calming, relaxation, and can promote restful sleep.
And another one's altitude. I know you wrote a column this week in Explore Big Sky about altitude sickness, and that sometimes can get almost confused with some of the COVID symptoms, flu, et cetera, et cetera. So do a quick advice on altitude and what people should be looking for there and trying to avoid and trying to help make their vacation a little more enjoyable.
Yeah, definitely back to the hydration for that one. We do a lot of IVs for altitude sickness. But I would say for the most part, just try not to push it when you first hear. It does take a little bit of time to adapt to getting used to being at higher altitude. If you need to get lower, I have a lot of people who just go from the mountain down into town center in a couple of hours and they're feeling a lot better. Broths are really good. Anything in terms of increasing nitric oxide production. So like beetroot juice is really good. And then just trying to limit some of the alcohol and sugars and things like that are going to be more dehydrating.
Excellent. All right. Well, I appreciate your time. Once again, Kaylee with Dr. Kaylee Burns of Big Sky Natural Health's got an office right downtown center. Do you have a question for either Troy or Taylor if you're available still? If not, I think I know the answer. The question was, or Danny, you might be able to answer this, is some guests have asked, can they get testing up on the mountain?
Troy?
Sorry.
Yeah, Taylor, it's up to you. Certainly, I think Taylor can do this, but the B2 clinic has that capability right on mountain.
Yep. They do have the ability to do the testing and they can collect for tests that we run down at the hospital. So there is testing available up there.
Excellent. And Taylor, maybe this would be good just as a reminder to the community of what the capabilities of that clinic are and kind of hours of operation and what people should be utilizing that space for.
Yeah, so that's primarily, it's a urgent care is what it is. And so they're kind of outfitted to do like mountain type injuries. There's an x-ray machine up there, basic kind of type injuries. Anything big gets sent down to the medical center. They can treat, sniffles and colds and stuff like that. It's a lot lower level of care than what you'll see at the medical center. But if you go in there and they feel like you're too high, you need a higher level of care, they'll send you down to the medical center. So if you feel like you can go there, and if they determine it's too much, they'll send you down.
Excellent. All right. Well, let's try to put a bow on this, and we're going to bring an epidemiologist in to talk a little bit about what our society is experiencing and try to put a little bit of semblance of order to this mayhem. Dr. Jason Moore has got a PhD in epidemiology. He also, on a side note, does consult our business. We hired him to be an expert to come in to help our staff and our businesses not only operate or be able to set up operation standards, but as we have little outbreaks, like even this week, half of our staff went down. We were able to bring Dr. Moore in. He was able to talk to our entire staff about self-care, what they should be looking at, when they should get tested, next steps, that type of stuff. So it's proved to be really helpful, and excited to have you here today, Jason. So welcome.
Thank you. Thanks for having me.
So what's your reaction to what we got going on in Big Sky and 30,000 foot up? How would you classify what's going on here?
Yeah, it sounds like a bit of a mess. So basically, what you have going on in Big Sky is pretty representative of what's happening across the country. Now, large cities have a different flavor, but right now what we have going on is an increase in all of our players for the winter viruses. There's 9 big ones, 9 or 10 big ones, and out of that list, half of them are up 300% across the country. And so what we're seeing now that there's heightened awareness around COVID-19, we're seeing folks that are sick. They're coming down with a kind of a typical viral syndrome feel, cough, fevers, body aches, sometimes vomiting, diarrhea, those kinds of things. And they're immediately concerned that it's COVID-19. And this is the influx of people that are now hitting our emergency departments and hospitals. And that's the biggest tax on the system. Fortunately, most of the time, these tests are coming back negative for COVID-19. It is these other pathogens that are getting people sick right now. Yeah. So there's a whole lot of confusion and fear that's driving our current state.
So, a question that we asked earlier about an endemic versus pandemic, why don't you dive into that and explain to people what that is, and then how you apply that, especially to COVID and our future? Yeah.
So there's actually 3 words to kind of hammer out. The first is pandemic. Pandemic is, in this case, an infection or disease state that affects a whole lot of people in multiple geographic areas. An epidemic is a disease that affects a lot of people in 1 or 2 smaller geographic area. Endemic is when a disease state is routine for an area. It's something we see either all the time or seasonally. It's kind of an expected disease state in a geographic area. So the question that came up earlier, should we expect COVID-19 to become endemic? And the answer is, yeah, COVID-19 is going to behave like, there are 7 coronaviruses, 3 of them are bad, 4 of them we've been dealing with forever. It's going to become one of those that we deal with on a regular basis. It's here to stay.
And you start to see the CDC start to change some of its requirements surrounding COVID. I mean, where do we sit today? There was a question about, someone asked about when to get tested, when not, when quarantines, things like that. This is a moving target. Where are we at today, and where do you think we're trending towards?
Today, we are slowly but definitively pulling away from a reactionary state. A year ago it was very, very different. Now we have more tests available. We are still reactionary, but the CDC's recent guidelines on shortening quarantine times and those kind of things are pulling us away from the reactionary state and getting us more towards a place of sustainable change. Okay, it will not be sustainable for everybody in the country when they feel ill to run out and get a test or flood the emergency departments for long. Okay, so what we're moving towards now is more of a sustainable fashion, and we can get into it, but who should get tested, how that looks moving forward is going to be vastly different from what it is today.
Yeah. Well, let's use some real life examples, and then I'll be, open and say it. 70% of my staff is out in the last 2 weeks. And so you gave some good advice. I mean, there's a lot of aches and pains, GI issues, headaches, colds, that type of stuff. I mean, people that are watching this, I mean, I'm willing to go out on a limb and say 70-80% of Big Sky right now is probably sick. So, I mean, people that, are thinking about going and getting tested or not, or how to treat themselves, self-care, that type of stuff, I mean, high level up without people having underlying medical conditions, what is your advice?
Well, I'll tackle the testing part first. And I feel safe saying this because the current system across the country isn't sustainable. There aren't enough tests to go around already. So we're already at that place. But as far as testing goes, if you are high risk, immunocompromised, those kinds of things, or you're coming in contact with somebody that's high risk, you should be tested. Asymptomatic people should not be tested. Okay. The basics are going to come into play here with that, and those are the sustainable things we use. The wash up, wipe down, wash your hands, wipe your counters down. Those kind of things are very, very important. The basics work, and that's where we're eventually going to get back to. So to reiterate, testing, if you are high risk, you're going to be around someone who's high risk, those are the people who should be tested quickly. If you're asymptomatic and otherwise healthy, you don't need to be tested because it's not going to change anything that you do or is done for you. And obviously, folks that are very, very ill, progressive fevers, they're unable to keep food and water down, those folks are the ones who should go to the emergency department. And they're going to be tested there anyway at the discretion of the provider.
Yep. All right. Any sort of data trends that you want to share? That, I mean, you obviously have access to what's going on in our state as well as around the country. I mean, anything that's kind of note right now?
It is actually the most, I think probably the most important thing, which I touched on earlier, is out of the 9 or 10 pathogens that we see this time of year, 4 of them are up over 300% across the country. And that goes back to the conversation we started to have earlier about the fact that many people who are going in and getting tested, the COVID test is coming back negative, but they are still in fact sick. And I think that's an important one. And I say that because if those numbers were more normal numbers, then we'd be more concerned. But because these other diseases that are around every year are up so dramatically, that's what's likely pushing this over the tipping point.
Gotcha. Question from the audience. Do you think there will ever be a vaccine for all COVID variants?
Very unlikely, considering the type of virus it is. I think a healthier way to think about COVID-19 and the coronavirus is to think of it more along the lines of influenza, in which every year we have to work to kind of figure out what's the most likely mutation we have to address.
Yeah. You've spent a lot of time living in resort towns. I know Vail and Aspen are all going through similar spikes like we are. We've become a petri dish, it seems like, every 6 months when everybody from around the world drops in here. I mean, advice, once again, you touched on it a little bit, and Kaylee taught this as well, but any other advice for just being able to stay healthy, but also operate businesses and when not to come to work, when to come to work, that type of stuff. People are trying to figure out how to keep their doors open.
Yeah, and that question actually gets pretty nuanced based on different businesses and what they're doing. But the general rule of thumb for that is going to be, if you're sick, stay away. Okay, and that's the general rule of thumb. Stay away from others. Stay away from the workplace. That's the number one thing. If you're sick, you stay away. And then from there, all the other things we kind of talked about factor in regarding testing and the basics. Again, the wash up and wipe down, those kinds of things are really important, and not just in your home. They're important in the workplace as well.
Yeah. Danny, any questions from you? I mean, you've been frontline, literally handing out tests to people walking in the door, and I mean, you're getting everything from asymptomatic to, well, you're not even dealing with symptomatic people. You guys are doing a complete asymptomatic testing system. I mean, I guess, strategy behind it, or any questions for Jason?
No, I don't know that I have any questions for Jason. I think the most important thing for us was to make the resource available to the community. I think what you see nationwide is a massive scarcity of testing resources. And we are very fortunate in Big Sky to have the opportunity to be able to use these tests. One thing, just for reiteration, this is for community members. These are public tax dollars that were used to purchase these had to turn someone away today that was a visitor. So just help spread the word on that. If anyone could, that would be helpful.
Yeah, no, absolutely. Jason, any kind of closing predictions of, our community spiking pretty hard right now? I mean, what you think will kind of trend towards this winter, and where you feel this COVID variant's at?
Yeah, I think the Omicron variant is going to behave a lot like the Delta variant, and they are very high level of transmissibility, very contagious without being quite as deadly. At least the data today shows that. And so what I think is there's going to be kind of a sharp spike and then a rapid drop off, because a lot of people are going to catch it and then a lot of people are going to recover from it, which makes them, at least for this year, they won't catch Omicron again. And that's what I think we can expect to see. That's my guess.
The businesses that you're consulting, Jason, I mean, kind of the different makeups. I know you're also doing you help people that are doing events. Even here in Big Sky, you wrote our protocols for Big Sky PBR and our concerts next summer. What's the way that you're, from an epidemiologist standpoint, you're starting to reapproach workplaces or events, and where do you think the future lies for us in the near term?
Yeah. So this is one of those instances where you take all the science, the vast amount of science, and you try to beat it down to, I mentioned this earlier, simple and sustainable practices. Because very complex practices and disease mitigation are very impressive, but they're not sustainable and they're very expensive. And the goals, as you mentioned, is to keep these businesses open and keep both staff and customers safe. And so what you look for in each business is you try to find a sustainable way to keep them open, embrace the basics, and then at higher level understanding of what's going on. And then you try to anticipate future trends and try to set these businesses up for success.
Yeah, absolutely. Anything else? I mean, you wake up every day and get questions from family, relatives, us, or you're in an ER dealing with it. Any other things that you felt we didn't touch on today as a community, and or words of advice?
Yeah. I want everyone to breathe on this one. The level, because fear does not allow you to make rational decisions, and there is a scarcity of tests coming soon. Big Sky is very fortunate that it has tests available now, but there is going to come a point soon where these tests are going to need to be preserved for those who need them. So be smart about things. Take a breather. Okay. Remember the basics. Dr. Burns mentioned how to keep yourself healthy. It's really important. Okay. Everyone talks about it. Everyone knows it, but it's truly very, very important. When you are sick, stay hydrated. I had mentioned with a client last week, the 4-5-6 rule, right? 400 milligrams of ibuprofen, 500 milligrams of Tylenol every 6 hours for a day or two, just to help you get over the symptoms. Obviously, if things get worse, you go get seen in the emergency department. High-risk folks should be tested, and they should be very cautious of their symptoms and err on the side of caution. But for the average healthy person, feeling a little sick is okay, and there's no reason to panic.
Excellent. So you don't think it's justified that all the grocery stores are missing all the cold and flu medicines and vitamins?
It's probably not justified, but I hope you guys get another shipment in soon.
Yeah. All right. Well, I appreciate you, Jason. Before I send it over to Joe for the final closing words, I just want to thank you personally, all of our panelists, for jumping on. It's a great privilege to have all of our community leaders get together like this and be able to share words of advice. Like I said, in 22 years, this has been one of the stranger times that I'm experiencing in this community. But as Danny said too, it's leading by being kind and being resilient as a community is what's made Big Sky really special over the years. So I would encourage us all to keep patient, keep good open communication. And also, I think one of the things that has really come across to my staff and myself over the last year or 2 years with COVID is really focusing on that personal health. And that baseline stuff is so critical before we're all going to get sick. I mean, everybody is going to catch something. And so what's interesting is that no matter if you're in the ER or if you're at a naturopathic medicine like Big Sky Natural Health or talking to Jason, everybody keeps coming back to these basics of take care of yourself and stay hydrated and stay healthy. So when this happens, you will hopefully minimize the impacts and then utilize the resources when they really need them. And I think that's one of the important things that I think as a community, we need to really focus on, because our resources are limited up here. So once again, I'm grateful to the panel, and I'll let the editor-in-chief, who's got the big VP next to his name, close us out.
Thank you, Eric. I appreciate that, and very much appreciate all of you with us today. It's been eye-opening. It's been very interesting. I think it's been very informative as well to a lot of people. You know, obviously, a couple of things that I see we see around town is there's lots of people here, and there's lots of snow, which is a great thing. So we got to remember, obviously, we've got to keep healthy. Let's keep that front of mind. But the big thing that stood out to me among a number of panelists, Eric, you just touched on this again. Big Sky Medical Center, Taylor was telling us, seen record numbers now, and 300% of testing numbers. A lot of people getting tested. There are a lot of people sick from a lot of different various viruses. There's extreme pressure on our medical staff. Those guys are working night and day, very hard. And so along with the medical staff, we also need to recognize that these businesses in town, they're having staffing issues. There's still supply chain problems. I think that we need to I want to just reiterate what everyone has said: be patient, be kind. This is the time when we need to pull together as a community, and really appreciate all of our panelists coming in on with us tonight. Troy Nedved, Big Sky Resort; Taylor Rose, Big Sky Medical Center; Danny Burswood, Big Sky Resort Tax and Big Sky Relief; Dr. Kay Burns, Big Sky Natural Health; and Dr. Jason Moore, who has a PhD in epidemiology and as a PA as well. Thank you all for tuning in. We really appreciate it. On behalf of Eric Ladd, publisher of EBS, and myself and our whole Outlaw team, we just want to wish everyone a happy new year. We wish you the best for 2022, and just stay healthy and safe out there. Guys, have a great evening.